I am nobody's stooge. I am not here to play somebody else's game. I have a few million people's lives to account for. And Singapore will survive.
Shortly after gaining independence on August 9, 1965, Singapore faced many problems such as health and population issues. Many policies were implemented which had an impact on modern Singapore today. Singapore's population was growing at an alarming fast rate which would threaten the success of the country. Thus, the government introduced the Stop at 2 campaign in 1969. The policy had a very successful response and the population started to reduce as couples started to realize the benefits of having a smaller family. In 1986, a policy, 3 or more if you can afford it, was introduced as the government saw this as a social problem. With fewer babies born each year, there would be fewer young people in the population. The number of older people would be proportionately larger. This means the country would be faced with an aging population. More resources would have to be used to take care of the increasing number of senior citizens. Now, the elderly population in Singapore is increasing and a kind of policy, baby bonus, was introduced.
With each bundle of joy comes some financial help. Under the baby bonus scheme, parents are given a cash gift of up to $4,000 each for the first and second child, and $6,000 each for the third and fourth child. The government also gives a dollar-for-dollar match when parents contribute to their child's children development account. The baby bonus scheme was introduced in 2001 to encourage more Singaporeans to have babies, but still the country's fertility rate remains low.
There was also a need for basic health care for the people. Infection diseases such as tuberculosis were common and spreads easily. A national health plan was created by the Ministry of Health in February 1983. The 3 main aims of the National Health Plan are to build a healthy and physically fit population, to encourage Singaporeans to stay well and reward those who do, and also build up individual financial resources so that those who fall sick will be able to pay. The National Healthcare Plan suggested that healthcare policies should not put a strain on government spending. They encourage shared responsibility and community support. The government would also maintain policies to keep healthcare affordable. The approach to healthcare in Singapore are separated into 3 groups: individual, government, and community. One of the measures to encourage self-reliance was a savings scheme called MediSave, introduced in 1984. MediSave encourages Singaporeans to be responsible for their own health. Even with MediSave, people who required long-term treatment of more serious illnesses were not able to pay for their hospitalization. Thus, MediSave was introduced as a way to help this group of people. Over the years, the use of MediShield has been expanded to meet the specified needs of the people. In 1990, MediShield was introduced, and in 1994, MediShield Plus was introduced to cover hospitalization in A and B1 wards. In 2002, ElderShield was introduced to cover disabilities for people above 40 years old. In 2005, Reform MediShield was introduced to cover larger hospitalization bills for patients in B2 and C wards. Comparing the healthcare services in Britain and Singapore, they have similar problems but different solutions. For example, in Britain, they actually have a kind of welfare system which provides free medical services to its citizens. Britain actually had problems as the welfare system was unable to meet the expectations of a healthcare system that was free at the point of service. There were also actually too many people who wanted to use the free medical care.